I'm Jess Berry, an ophthalmologist and ocular oncologist at Children's Hospital Los Angeles and the University of Southern California Keck School of Medicine. I chose ophthalmology because the eye is the most beautiful organ. I was actually really interested in public health in medical school and went on some missions in Africa, one of which was an ophthalmology mission doing cataract surgery. The very first time that I saw a surgeon perform this delicate surgery on the eye to remove a cataract and restore someone's sight, I was absolutely sold that this was the best specialty for me. I, of course, perform very little cataract surgery these days because I'm an ocular oncologist. And that came about because I spent my internship in New York at Memorial Sloan Kettering Cancer Center. And I did that because I wanted a great internship and to spend a year in New York City. But while I was there, I was exposed to patients with melanoma of the eye and children with retinoblastoma specifically. And I absolutely fell in love with the kinds of disease processes you see as an ocular oncologist, the way in which you can look into the eye of an adult or child and see a cancer directly, and then see that cancer respond to therapy. And the way in which you really play a critical, pivotal role in the lives of your patients during these times as an ocular oncologist. I don't have a routine day to day, and that's something that I love about this subspecialty. I operate and treat diseases from the front of the eye all the way to the back of the eye, including the intraocular space. I work on adults and children, and I often tell my medical students or residents that I'm like a comprehensive ophthalmologist with a focus on ocular oncology or eye tumors, because there are really very few specialties within ophthalmology where you get to diagnose and operate on various tissues of the eye, and I really love that. The other part of my job that I adore is research. So ocular oncology is a rich field for research. I never expected to be in the laboratory, but found that in order to answer some of the questions that were impacting me and my patients in the operating room, I had to go to the laboratory for answers. And so have been really heavily involved in creating a liquid biopsy for retinoblastoma, which is a special area of research and a special thing that I'm able to do and feel like I'm able to contribute to the field in general. There are very few ocular oncologists in the world, as you can imagine, so it becomes a small tribe of colleagues. We meet up at meetings. We all know each other very well. We're able to share our difficult cases and get advice from one another, and I really appreciate the smallness and the interconnectedness of this field. You know, there are many fields within ophthalmology where you will make a huge impact on a patient, particularly in your ability to either save, preserve, or restore sight. And I sometimes get to do that in ocular oncology as well. But what I find really special is I get to be there with patients or with parents of a patient at a really critical period in their life. I am able to explain things to them and help make the decision that's best for them and their family and be there with them every step of the way. I can't imagine doing anything else. I love what I do. I love that every day when I wake up, it's a new challenge and something exciting that I'll face. And even on the hardest of days, I come home knowing that I made a difference in a patient's life. I absolutely love ocular oncology and couldn't recommend it more. Thank you.